Hey guys, welcome to the Health Babes podcast. Today, I am so excited. We have Dr. Jess on, and Dr. Jess is an MD that was in the allopathic medicine world until she really discovered that her patients were suffering from anxiety, hormonal imbalances, fatigue, and she really wanted to seek out some real answers to this, not what she was, taught in school, basically. So she basically started to learn functional medicine. So things like ozone and, diet and lifestyle changes. And, she's just so amazing. She goes through all of this in today's episode. Some things that we hit on were biotoxin illness, which is a huge topic that everybody, is really starting to open their eyes to. Lyme and mold, how they could go hand in hand, which is really interesting. Because a lot of people get diagnosed with one and don't realize that maybe they have both. We talked about binders and the different types of binders, what the safer binders are, what our favorite binders are. And we all agreed on that too. So that was really exciting. And then we answered some of your Instagram questions because I got a lot of people asking questions for Dr. Jess. So go ahead and listen to our episode and we hope you enjoy it.
Hello,
everyone. Hello.
How are you?
Exactly.
I love it. Got to clean those windows,
Especially me, I lug this thing around everywhere, this laptop. So it's like, sometimes I open it and I'm like, oh my God, no one look at this.
I know there's like prints everywhere.
I know. I'm so excited to have you on here.
Same, guys. Same.
Yes.
I love the name of your podcast. It's like totally something I'd name my podcast if I had one.
Really? I know. It was the first name we came up with. We were like, Health Babes.
That's so cute. I love it. Seriously, it's adorable.
Oh, thanks. We try to live up to the hype, but sometimes, sometimes we make fun of ourselves. Like if we're not feeling well, we're like, Health Babes.
Woo, cheer ourselves up. So Crystal, I haven't met you before. I know I've never met either of you. Becky, I know of you because I know people in JJ Virgin's group.
Yeah.
And so I've heard about your podcast, but Crystal, I have never met you. Are you in JJ Virgin's group too?
Nope, I'm not. I have my own practice and then I started working in Bex and then we have the podcast. So yeah.
And we're writing a book now too.
Yes.
So.
Okay. What's the name of your guys' book?
Well, we're doing it on hormones. So something along the lines of hormone balance with the Health Babes. We're still working on it.
In it. It has to. Yes. I love it. Okay, perfect. Well, let me know when it's ready to go.
We will for sure. And I'll send you, I have my third histamine book coming out. I'll send you a copy too.
Oh, amazing.
I launches first. So we're busy.
Yeah. You guys really keeping it going on. You got it going on. I like it. Let me put my do not disturb on. Okay.
I know, right? All the things.
The worst thing ever is like someone calls you in the middle and you're like, why?
And it's on your computer and you're like, oh, I know. It's tough.
It's like in your ear, it like breaks my eardrum. Yeah.
Yes. Well, let's dive in. Let's talk about how you got from allopathic medicine to functional medicine. I want to hear more about your journey.
Absolutely. It's kind of a wild ride. Mm-hmm. So if someone had told me, I don't know, a decade ago, I'd go through this, I'd tell them they were crazy. Yeah. So I started out truly believing everything conventional medicine taught me. I went to medical school. I'm born and raised in West Virginia, and I went to medical school in Louisville, Kentucky. So I didn't know about chiropractors. I didn't really know about naturopathic school. All I knew was conventional medicine and medical school that way. And so I bought it hook, line, and sinker. I got my flu shot every year. I ate all the cafeteria food. I didn't think there's anything wrong with omega-6 or processed dairy. I, sent people home as a hospitalist in the hospital for 7 years on 50 medications.
Wow. Yeah.
Yeah. So I've done a complete 180. I should probably change my name at this point. And so, I literally practice more naturopathic and holistic than some naturopaths, I think now. Mm-hmm. And it's been a radical change for me. And it hasn't always been fun because let's face it, awakenings are like, you have your own foot in the boot on your head, right? Mm-hmm. You're your own worst enemy. And that was the case for me. So it was, a slow trickle and burn while I was in a hospital as a hospitalist. And I finally decided through Instagram and hearing other people talk, I would go research and I would go say, this sounds crazy, this about food or this about this drug. And I would go research and see that it was true. And I was humbled. And so at that point, I signed up for Gerson therapy.
Wow.
And so that was in 2015. And by the time I was done with Gerson and I knew how dirty tap water was and how awful Teflon was, I thought I can no longer continue in this conventional medicine world. It's tugging at my heartstrings. I started to be a disruptive physician. I started to complain about the hospital food and the 50 medications. And they told me, shut up or you can't work for us anymore. And I said, I quit.
Yeah.
And I went and shadowed a naturopath twice a week. I worked at Whitaker Wellness with the great Dr. Julian Whitaker, who was my mentor. I got trained in ozone therapy. And then lately I've been trained at the Institute of Functional Medicine. So I'm so grateful for the pain and the times I went through where I was dead broke because I was in the middle of a transition, because now I wouldn't change it for the world. I help people really heal and get to the root cause, and it was all worth it.
It is worth it, isn't it? It's such a journey.
For sure.
That's amazing. It's so, it's like I give you so much credit too, because the backlash from the conventional medical community is awful. I mean, it really is. And it's you're really the whole purpose of medicine and, becoming a doctor, whichever type, is to try to help people. So it's like, why do you get upset when we find alternative ways to do this? But it's true. They don't like it.
It's so hard to put a subtle energy that you're trained with for 4 years into words.
Yeah.
They don't come right out and say you're the best, but there's this subtle training for 4 years that you're the smartest, you're the best. This is a very prestigious career. And after hearing that subconsciously over and over, even through residency, and then, the public saying that some to you too, right?
Oh yeah. Yeah.
Right. So it really gets ingrained, and it's something that is not conscious, but they have a chip on their shoulder. Everyone wants to help someone. They really think that what they're doing is best. But when challenged, we weren't really taught that perspective in medical school, how to handle that and how to step down with grace when someone may know something we don't.
Yeah. Or like expand your knowledge and learn more, okay, how can I incorporate diet into what I learned in medical school, or, just lifestyle changes and stuff. I mean, we do see it, we're seeing it more and more, like you said, on Instagram and that type of thing. But just as far as like clinical settings, we have patients who tell us, my doctor says that diet has nothing to do with your health. And I'm like, what? I mean, how can you deny that?
I think what it is that, I probably got 4 hours of nutrition and diet training and school, guys. I mean,
no, firsthand.
No, not at all. It was more about, like, let's learn the essential amino acids, right? So it's now I think for some docs, having to admit that their training was flawed would be having an identity crisis, because so many doctors identify with being a doctor and knowing what they know. And that's kind of like, so causes so much cognitive dissonance that the world that they were trained in might have not been fully honest.
Right.
Yeah, that makes sense. So let's talk about biotoxin illness, because we're hearing about this more and more. And it's something that everybody really needs to know about, because if it's not you, someone has been affected by this point. So, where do you get it? What is it? Let's kind of dive into that.
I'm such a nerd. I'm like, ooh, I know everyone's talking about it finally.
Yes.
Such a nerd about biotoxin illness, but it's great because I feel like this is a big problem that's been overlooked for years, especially with modern day building practices.
Oh, yeah.
First and foremost, I don't want to necessarily blame the mycotoxins or the microbes. They're not always mold. It can be gram-negative bacteria, even a gram-positive bacteria called actinomycetes. And so, they're there because we're building things wrong. This is not the way nature intended things to be built.
Wow.
There was a study that showed that 43% of current homes had acute current water damage, and about 84% of homes had previous water damage. So how can we say that this is happening so commonly in modern housing? And it's because we throw things up so quickly with convenience. We leave the wood out in the elements, so it gets rained on. Does that ever dry?
Right.
Right? We put gypsum, also better known as drywall, inside our modern buildings, and ironically, drywall never dries when it gets wet. It also
Wow.
attracts stacky boy trays. The really toxic, infamous black mold likes to eat and live on the cellulose content of the gypsum. So there's, I'm not even talking yet about like the VOCs that are in adhesives and paints and all that stuff with modern housing that sets people with multiple chemical sensitivities off. And then it also attracts some of these microbes that belong to an ecosystem that digest organic waste. What are we using in our homes?
Right.
Yeah.
Yeah. And just going back to the housing and stuff, I live in Florida, so mold is huge here. I mean, it's a problem. There's so many houses by the water, and, I know someone who built a house and they were like, well, there's no way that there's mold in the house. It's brand new. Well, there was one piece of wood that was so like wet, and then it just started the whole cascade of events, and they ended up finding mold down the back of the walls and crazy.
In the new home.
Home. Yeah. Less than 2 years old, they found it, and they were sick when they moved in. But, again, like you're saying, all the other VOCs, the new paint, the new carpet, the new flooring, everything. And then you throw mold in the picture and you get a chemically sensitive person in that house. It's flip their world upside down.
Like a bomb goes off in their body. It literally is the igniter of disease. And I mean, people don't understand. They think, oh, I'm eating all these healthy foods. What's wrong with me? Why do I have brain fog, unexplained weight gain, pins and needle sensations on my extremities? I can't hold my urine at night. Right. All these things. I'm eating perfectly. I'm not eating anything processed. I'm eating organic. And people forget that there's other exposures. It's stuff we breathe in, right? The air, which is our indoor air, that's 90% of our time spent is indoors. So, if all this stuff is floating in the air that we can't see, there's an exposure that a lot of us don't think about. Also, we've shown that mycotoxin spores can absorb in the skin. So things we put on our skin, lotions, all that stuff, soaps, including what's floating in the air that can absorb in the skin. It's something we all should, put our awareness on and think about. It's important because it's not just what we put in our mouth.
Oh, yeah, for sure. Yeah.
Let's talk a little bit about opening up the drainage pathways. And this is really important, we know, for biotoxin illness. So let's dive into that.
Yes. And I probably should have said before, biotoxin illness doesn't encompass Lyme as well, you guys. Lyme and mold kind of go hand in hand and play off each other like frenemies in a toxin bucket. So moving on to drainage pathways, which I think is so underrated, and people don't understand this is exactly where you need to start. I don't care if you have autoimmunity, cancer, you have biotoxin illness, whatever you are dealing with, you need to start here, because especially if your diet's regulated, you're doing everything you can to eliminate exposures in your local environment. At that point, what's still keeping you sick? If you're putting in all the nutrients that's needed for the body, it's not a problem of an addition that's needed. It's a subtraction problem that we have. I'm more of a subtractionist. So what exposure have you had over your lifetime or on a daily basis that enters the body and the body becomes stagnant in one of these pathways? It's not able to dump that exposure. People who have exposures on a daily basis that do not get sick, it's in and out, and out, right? And how do they do this? Sweating, pooping. Let's just be real.
Right.
It's got to be regular. If you guys aren't pooping, like, how can you think straight? You're holding on to toxins, right? Lymph movement, super important. We forget about the lymphatic system, and sweating too, which is part of it. Also, our mitochondria have to be turned on. Our little energy makers in every cell have to be going. You have to be sleeping okay. We have to think about bile movement. If you can see half your dinner come out the other end, we may have a problem with a stagnant bile pathway. So there's so many things that need to be addressed before we go killing off something in the body. Most people can feel up to 50% of the way better, even more on exception, once they just open these drainage pathways up, because their bodies are brilliantly made. And if a doctor is going to work against the body, they better be careful by shutting off other pathways. A smart person will work with what God created and gave us. And that is naturally working with how the body wants to dump things anyway. Find out where it's blocked and talk to the body.
Yeah, I love that.
Yeah. What are some ways patients or people can, really work on their detox pathways?
Yeah, that's a great question, because that's the next things people ask me.
Mm-hmm.
And that's sort of where the art of medicine and healthcare comes in, because everyone is unique and bio-individual. And you can't, we can standardize some things. I have some protocol questions I ask everyone with drainage pathways that we can get into. But really, there's going to be unique roadblocks and exposures and traumas that every person has that need to be untangled and teased out. And so, for example, people say, how do I know if my liver is working or not? 1 in 3 people in the United States have a stagnant liver pathway. This is super common. Yes. So questions I ask, which I feel are sometimes better than testing blood work like AST or ALT on the labs, because 80% of the liver so has to be damaged before those show up. Right. Elevated. So questioning, and this gets into people's genetic bio-individualities as well, but also really shows me if someone's stagnant here. So for example, do you have headaches all the time? Do you get rashes, eczema, psoriasis? Do you have a short fuse? Are you frustrated a lot with yourself or other people, or have trouble with envy, jealousy, anger? Can you tolerate coffee or caffeine okay? Is there a point where you'll have too much coffee in the morning and you'll feel like a jittery mess or very anxious? How do you fast? If I was going to ask you to water fast, would you get hangry, homicidal, want to kill your significant other, want to pass out, dizzy? That's the liver problem. The liver breaks down glycogen into glucose to sustain your blood sugars in between meals. The adrenals set off cortisol to have this happen. So the adrenals and liver have this play together, right? So you can tease out how people feel with their anxiety and their frustration through the liver pathway. Another one I ask is, if you drink, are you a cheap drunk? Like if the hangovers for a couple days, the liver processes alcohol. In Chinese medicine, the liver is connected to the sinus cavities, eyes, head, as well as the reproductive organs. So I can see problems in those areas when people have a stagnant liver pathway. So oftentimes my questions will elicit a little bit more than some of the archaic blood work that we still use.
It's so true. Yeah.
Do you think that mold acts as an endocrine disruptor?
Absolutely. Yeah, I've actually spoken at many conferences on this. Specifically, fusarium, which is zearalenone, is the most potent endocrine disruptor out of all the mycotoxins that we know right now anyway. This is a kind of a newer field of science. And so zearalenone actually can mimic estrogen, bind to its receptors. In animal studies, piglets are born with increased size of their labias and show hyperestrogenic syndromes when they're fed moldy maize with zearalenone or fusarium. They also have a lot of other estrogen symptoms in all the animal studies. It's very concerning. We have seen this. I have seen this in patients on my own. Absolutely. You can get a Dutch test or check some of their hormones and see estrogen off the charts with this. And really, women will have all the high estrogen symptoms. Another one that's not quite as potent as zearalenone is ochratoxin. And ochratoxin also can mimic estrogen as well. And it has shown some of the hyperestrogenic syndromes or symptoms in animal studies as well.
Do you want to give us a little quick rundown for those that don't know what excess estrogen looks like as far as symptoms?
Absolutely. So if you guys, especially a few days from your period, but this could be all month long if it's a severe, estrogen dominance type of picture, or even a decreased progesterone, you guys, because the body views itself in checks and balances and ratios. And so a high estrogen with a normal progesterone is still high estrogen. Right. A low progesterone with normal estrogen is still high estrogen, right? Exactly. So there can be a number of different combinations that make you feel this way. But if you have swollen, tender breast, headaches, you're super moody and irritable, you might be having night sweats, really difficulty sleeping. There's horrible PMS, usually lots of cramps, heavy flow for some of these women. This is just some of the symptoms of an estrogen dominance.
Yeah. And we see that a lot in our practice. A lot.
I bet. It's very common. I mean, hormones are, they're chemical communicators. So I always tell people, if they're off, your body's talking to you, and get to the root cause, because they're usually not root cause, they're talking to you.
Yeah.
Then estrogen dominance is driving things like thyroid issues and histamine intolerance and that type of thing.
It's a domino effect.
Absolutely, right? Because histamine binds to estrogen receptors, right?
Yep.
So it's a vicious cycle, just like you said.
Yes. Let's get into binders. Let's talk binders. Jess, I actually took your Kilobind sweat course, which I love. Yes, a while back. Yeah.
I hope it helped you.
It did. I've been following you for so long. So this is so fun. But
so nice to meet you.
Yes. Let's talk binders.
Sure. So binders, I wish everyone on earth knew about. And I wish that if you're not too constipated, because that's a no-no if you're constipated, and we'll talk about that. But if you're not too constipated, I think everyone should do, a cleanse once or twice per year, because we all have exposures on a daily basis and things that are in our body that don't belong there. And toxin binders are molecularly sticky. So they're usually in a pill, a capsule, a powder. You can take them and they're able to bind up toxins, heavy metals sometimes, different pathogens, and, man-made toxins and chemicals in general. Depending on what you're taking, they all have their specialty. And there's a bunch we can talk about and examples we can give. Some examples include someone everyone's heard of, like activated charcoal. I'm sure everyone's like, oh yeah, I took that once for a hangover. And it works great for that because it just stays in the gut. So it binds things up and doesn't leave the gut and go systemically. Some of the best binders that are on the market are enlightens bentonite clays. They have a wide variety of mycotoxins for biotoxin illness that they can bind up, and other man-made toxins as well. And most people probably have heard of those. And then I think the top of the line binders are bioactive carbons, which take other things, but activated fulvic and humic acid, and some of the yes, exactly. Some of the are cleaving them. So they're creating increased microporosity or increased binding sites. So they become even more efficacious than they normally are.
Yeah, we love fulvic acid binders. I have a question. So, with charcoal and the bentonite clay, do you think that there's more of a risk of binding your own minerals than there is with the fulvic acid?
Totally. Great question. Absolutely. Fulvic and humics are interesting because they come from the soil. So you have to make sure your soil is clean. But they're really great because they not only are mild binders, which we increase the efficacy with cleaving binding sites, like I said, but they also help to turn on a number of anti-cancer, really healthy metabolic pathways in the body. And so I love them, like you guys said, because they're gentle, and they also help return the body to homeostasis so it can fight on its own, which is the best way to fight.
Yeah. We love that too. Cause whenever I, in the past, would put someone on anything other than, fulvic acid, I would make them take minerals too separately. Because of the ability for them to bind that, because sometimes they get depleted, or they'd be like, I'm having muscle twitching, or, certain things. So
absolutely.
So I wanted to ask a couple of questions from Instagram, because I can tell you that I don't always post for guests for questions, but I got tons of questions when I posted for you. So
you're pretty popular.
How much you're loved.
I love the online audience. They really want to learn.
They're great. I know.
Yeah, they really are. Okay. So this is a question that we got a couple of people asking the same question. So strategies for losing SIRS weight gain. So do you want to explain quickly what SIRS is and then talk about that?
Sure. So SIRS stands for chronic inflammatory response syndrome. And that's I would say the more severe form of mold illness for most people. A lot of them have Lyme co-infections involved as well. So I don't want to, put anyone in a box here. Weight gain from that occurs because in SIRS, the cytokine storm, mold and Lyme people are the OGs of cytokine storms, and they unfortunately have not been recognized. But mold and biotoxin illness cause a cytokine storm because one side of the immune system is signaling, hey, there's a huge problem here. There's a foreign intruder, like a mold spore that we can't see very well, and the other side of the immune system can't see that signal. So you have an imbalanced immune system, and then the immune system creates inflammation because that's how it talks to the rest of the body, and the inflammation starts to actually destroy leptin cells in the hypothalamus. The body responds by increasing leptin receptors throughout the body, and when this happens, the body is out of balance again. So you can be eating the same amount of calories you always did and start to gain weight because it's actually due to inflammation, leptin cell destruction in the brain. So the body responds by upregulating things. And that's why people really have trouble with weight gain. I have seen a couple different mycotoxins cause people to lose weight, but they're in the minority. So what do we do about it, right? What do we do? This is a hard one. First and foremost, you have to get out of the mold, especially if you have SIRS. If you are HLA-DR, which is the genotype, the genes they can check for, it's a blood test to see if you're sensitive. You have it, really?
Yeah.
Yeah. I mean, you can't be in the house. You're one of those people that I can sometimes open your drainage pathways, but most of the time you have to be out. And I never know until we just try with these people. So that's very important. If you really are serious about losing weight, we have to make sure you're in a clean environment. The other thing is going back to what I mentioned earlier, which is opening drainage pathways, because your body will create and continue to create that cytokine storm until we can calm it down and bring it back to normalcy or homeostasis, set point, right? And that happens by dumping the intruder out of the body, right? And so we have to go really careful with these people. A lot of times I don't like to give them supplements right off the bat. I like to do extracurricular activities, as I call them. Let's make it sound fun. So, even if you have, let's say, POTS or palpitations, you have trouble sweating, that's a problem. We need to turn that pathway back on. Sweating is a great way to release mycotoxin spores with binders. And so even if you can only do 5 minutes in a sauna, do 5 minutes in a sauna, and we'll add a minute on each week, right? I've got to have you pooping. That's a great way to release toxins and mold spores. So with these people, I often get them, castor oil packs on the liver. Right on the lower abdomen to help things move. Really, some people respond great to that. Other people are more stubborn. You guys know these people. I would love people to get out in the sunshine and move and walk. If you have the privilege to move your body, then everyone should be moving their body. It is absolutely should do so. Yes.
Yeah, we really love limbic work, with really sensitive patients, right?
You have to, things like if someone is on a budget, something like DNRS, which has a 90% success rate. It's just, you have to be proactive. It's either money or proactivity, right? Not usually both. So it's a time versus money thing. I love upper cervical chiropractors for stuff like this. Oh my gosh, I love cranial sacral work.
Yeah. Cranial sacral is really good in this situation. Good. Yeah.
EMDR. I love even getting into the trauma work of things with people, because you have to go back to that vagal dysfunction. You cannot heal anyone in a state of flight or fight.
Well, speaking of vagals, someone asked us about that, and I'm trying to find.
I know.
I just want to point out, I lived in mold and could not smell it, and I don't know why, because I can always smell mold. Wow. And I got so sick that I literally thought I was going to die. I mean, I kind of didn't care if I did. That's how sick I was.
I remember
and
that.
Before finding the mold, I actually took my breast implants out thinking I had breast implant illness, but didn't, was like, okay, going back, I moved into a different room while recovering from the surgery and started to feel better. And I was like, wow, this surgery is working. I mean, I just got this, and wow, But then we later, like a couple of weeks later, realized that the room I was sleeping in literally had mold coming in from the floor, soaking the carpet, and just this black, I mean, it was
underneath her bed.
underneath the bed. So when we moved the bed, this like smell was overbearing. I mean, but I couldn't smell it before we moved the bed.
Yeah.
Sometimes people get so sick and their toxin bucket gets so full, it like turns off senses almost.
Yeah. It was crazy. And so the only thing I could tolerate while I still lived there before I knew was castor oil packs. I couldn't even take vitamin C. Like I could not take any supplements. But then when I got out of it, that's when I was able to still do like gentle detox first and then start incorporating some supplements and got my life back. But it was a nightmare. I mean, we feel for people with mold illness because we know.
Yes, you do firsthand, but you're one of the best people for people to talk to because you know what worked and no one can tell you differently.
Yeah, we work with a lot of that. We work with a lot of patients with mold illness.
Yeah, it's really good to start gentle. People appreciate
when you have to. And we work with mast cell activation syndrome, which I also have. So of course my mast cells were going crazy then. And so we're, you know, we know how to work with really, really, really sensitive people. So sometimes you can't do anything. We just put them right into brain retraining. I mean,
yeah, they need to be doing that with like sometimes if they can tolerate, if their, you know, liver, adrenal, mitochondria pathway isn't too shot, they can sometimes do intermittent fasting to help a little bit. But it's so, I agree, brain retraining, people, if they're pinged all the time, sometimes they don't even realize it, you know?
We love the Gupta program. We had him on. He's the nicest person in the world. And his program we have a patient who couldn't walk at all. And we put her on the Gupta program and just a little bit of like gentle detox and, you know, took the inflammatory foods out of her diet. And she was probably high histamine, right?
Yeah.
So we reduced the histamine coming in, which obviously would cause more inflammation. And she lives a completely normal life now.
That's
like
amazing.
Exercising all the time. And
I've never heard of his programs, so thanks for that.
Oh, he's amazing. It's Ashok Gupta. It's Gupta. So we love him. It's like DNRS. It's just like DNRS. It's just it's a little, I think, less work. I don't know how to, you know, I don't want to discount the DNRS because I know that that's also amazing too.
I found the vagal question. I'm going to ask that.
Okay.
And we can talk
this
about
is from Instagram too.
Okay. How to get out of dorsal vagal tone.
Right. That's a hard one. And it's a very simple question with a very complicated answer.
Right.
So, I'm sorry. Isn't that how medicine is? So basically, guys, it goes back to feeling safe and secure and the fact that you belong in the world. And if you can't say that I do and yes to those questions, then we need to do some work. And a lot of times for people that goes back to their childhood and feeling that they didn't belong or they weren't safe or something happened that really triggered, safety with the people that are supposed to love you. And, we need to go back to those subtle energies that are still kind of stuck in your body that come out in your daily behaviors and thoughts that you may not connect to your childhood, right? And I see this a lot. So, and sometimes it can be as a teenager, as adult, something really traumatic happened that kind of pushed that on button in flight or fight and it just stuck there.
Yeah, like sympathetic overdrive.
I've seen this in Olympic athletes that I've had patients in. I've seen this in professional fighters that I've had as patients. The overachievers in general, perfectionists in general can have this syndrome. And a lot of times people will get into work mode and be workaholics so they can distract themselves from their own shit. Sorry.
Yeah, it's the truth.
And that's also the healer's plight as well. Welcome to my world. So, I think with you guys, first and foremost, you have to analyze your lifestyle and your thoughts. Do you have a spinning thought virus that you constantly go back to every day? Are you constantly worried? Are you constantly go, and you are just a human doing and not a human being? These things matter. And oftentimes vagal dysfunction is one of the hardest things for me to treat because I have to address people's subconscious thought patterns and behaviors and beliefs.
Yeah.
And trauma. And that can be very difficult. And so I would ask you to really sit in quietness. I won't even say meditation, silence. Sit in silence and ask yourself, are you balanced? And as much as you let things come to you, as much as you do and go after things, right? There's a balance between yin and yang and masculine and feminine. And we in society, we're all in yang. Right. So how can you bring your thoughts and behaviors back to being in balance like we're supposed to be? And that's really difficult with people's work schedules. So as you can see, I put them in brain training. I have conversations with them like this. I get them into cold plunges and meditation and journaling and grounding and nature walks. And there's been many times I've said, okay, you have a prescription you have to go camping for a week. I'm sorry.
Yeah.
You know? So there's many things and there's not one right route for everyone. You have to hear what I say and be like, ooh, that sounds like my recipe. And if you don't know, I need you to sit in silence and get to know yourself better.
Oh, that's so powerful.
It's so true. And, I'm definitely one who lives in sympathetic overdrive. I mean, you can say boo and I will jump 10 feet across the room. So I've been, had to work on it. And what's worked for me is definitely, I don't have a tub and do cold plunges, but I do cold showers.
Oh,
But I do it at the end. So I take like a shower and then like my conditioner face wash whole part, I'm like in the cold. And the other day I was laughing at Crystal. I'm like, I just had the funniest TikTok in my head. I was like singing like Taylor Swift. And then I was like, ah! As soon as the cold water came on, I was like, I forgot I turned the handle.
Totally do that.
But that and then inner child work is really powerful. And if you don't even know that you've had trauma, you figure it out, because you can't compare your trauma to anyone else's.
Yeah.
So that
some of y'all's inner children out there are really pissed and rigid. Trust me.
Yeah. And it's crazy what comes up. I mean, you have to go into it with an open mind, but it's crazy what comes up when you do that. And then lately I've tried somatic therapy, which Christine Hassler introduced me to. And it's like movement therapy. Cause we have all this stored trauma like in our body. And with somatic therapy, you're moving and you're like, if you want to punch a pillow, you're punching the poor pillow.
Somatic dance a little bit, huh?
It does. And it works. I'm telling you, it's like after you do it, you're like, you're
exhausted.
Wow.
Yeah. So it's really cool.
Getting something out.
Yes.
Yeah. Clearing it out.
So like you were saying, everybody has a different way and a different route, but those are just some things that have worked for me. But I think there's so many things and it's never going to be one thing that works. It's going to be a big, effort on diet, lifestyle, whatever type of therapy works, whatever, vagal, vagus nerve, toning works for you, whatever it is, like to activate the parasympathetic nervous system. But there's so many things you can do.
And honestly, people who are stuck in fight or fight, they often have this medical PTSD from people gaslighting them, right? So they're afraid to try new things. So this is your guys' permission to please try new things. Don't be afraid because you don't want to be stuck forever. There's nothing worse than that. So even if you've been a little traumatized by the system, this is giving you this should be empowering to you because you can take back control. You can control how much your body needs or doesn't need here.
Yeah. Get really vulnerable in your healing. It's okay.
Right.
Yeah. Let's talk a little bit about your Wellness Plus app.
Yes. Yeah. It's been exciting. Wellness Plus. I've been very, very blessed and very grateful for this. I think part of the recipe to get blessings from the universe is gratitude, because why would you want to give gifts to someone who doesn't care? Right. So, so you have to be grateful. And I'm so grateful for Wellness Plus and my team. I have the most amazing team surrounding me, which hasn't always been the case in my life. And so, really, it was a former patient of mine who came for 4 years who I helped, and he came to me later and said, hey, I'm going to build you a site. He was my guy and a website builder and a site builder. And he does amazing work and his team is amazing. And so they built Wellness Plus from scratch for me. And it was amazing in record time. And it's just beautiful. The design is just beautiful. And I love what the medium they've provided me to educate the public on, because things that I can't say on social media, I am uncensored on there. And we have a community forum like Facebook. So screw Facebook, you know, I'm going to say whatever I want and talk about whatever I want on my own platform. And it's a free for all for people who want to heal, or even practitioners who want to learn. And so not only do we have a community forum, but we have, professionally written articles. I do a webinar every 2 weeks. I do professionally filmed courses every 3 months. We have 2 other doctors, a naturopath and another medical doctor in Spain, working on the forum to help me answer questions, because it's pretty popping on there.
Yeah.
And then we actually have root cause quickies. So the members can write in and say, lichen sclerosis, what are the root causes? And then the team will research and then provide some science-based reasons for why it may be happening, and then holistic ways to help remedy. So
it's so awesome. I absolutely just love your work. I've been following you for so long, and then you just launched this app. It's been a year probably, or 2 years?
No, it's been a year. It was a year last month, actually. Okay. Yeah. So it's super fun. We're always adding to it. It kind of, at this point, we're probably redesigning to organize and streamline things more, because, I have a bunch of courses and where to start, but we can always improve. And that's what we strive to do. We want to be kind of like the holistic WebMD.
Yeah, it's cool. Very cool.
Much needed.
Yes.
Where can everybody find you besides your app?
So I always say there's a hierarchy. There are levels to how you want to interact with me here. If you like free information, go follow me on social media, Facebook, Instagram, Dr.Jess MD. And if you like to read and learn information that way, I have a really great FAQs that people ask me on Instagram, just like you guys did this podcast. And that's on my just regular website, drjessmd.com. And then the app is app.drjessmd.com.
So awesome.
Well, thank you so much for coming on. You've been amazing. And I know that our listeners are going to eat this episode up. So
thanks for having me, guys. It's been my honor.
Yes, I'm sending you the biggest hug. Thanks again. We appreciate it.
Absolutely, guys. Thanks for having me.
And thanks for listening, everybody. And don't forget to leave a review, because reviews really help us and they help other people find what episodes they may like. So when you leave a review, don't forget to mention Dr. Jess. Okay. Thank you guys for listening, and we hope you have a great day.